The Bob Murphy Show, episode 185.
There's a tidal wave coming. What you gonna do?
Get ready for another episode of The Bob Murphy Show, the podcast promoting free markets, free minds, and grateful souls. It's your source for commentary and interviews conducted by a Christian and economist. Now here's your host, Bob Murphy.
Hey everybody, welcome to another episode of The Bob Murphy Show. Today I'm going to be talking again with Dr. Keith Smith, who we've had on the show before, and the specific impetus was he's going to be doing an event for the Mises Institute later this year, and so I wanted to get him on to talk about that. But more generally, we just talk about his experiences and what his mission is in trying to bring free market principles back to the provision of healthcare. So let me just read a little bit from his official bio, and then we'll jump right into the discussion. Dr. G. Keith Smith is a board-certified anesthesiologist in private practice since 1990. In 1997, he co-founded the Surgery Center of Oklahoma, an outpatient surgery center in Oklahoma City, Oklahoma, owned by over 40 of the top physicians and surgeons in central Oklahoma. Dr. Smith serves as the medical director, CEO, and managing partner while maintaining an active anesthesia practice. In 2009, Dr. Smith launched a website displaying all-inclusive pricing for various surgical procedures, a move that has gained him and the facility national and even international attention. Many Canadians and uninsured Americans have been treated at his facility, taking advantage of the low and transparent pricing available. His most recent effort is the launch of the Free Market Medical Association, which provides a platform where those seeking to obtain high-quality and affordable health care can find free market-minded providers, both physicians and facilities. Dr. Smith has made appearances on The John Stossel Show, CNBC, Huffington Post, O'Reilly Factor, Capital Account, Ron Paul Channel, NBC Nightly News, CBS News, and has been featured by Reason Magazine's TV division. So without further ado, here is my conversation with Keith Smith. Well, Keith, welcome back to The Bob Murphy Show.
Thanks for having me.
So, I do want to get into the newer stuff in terms of, the pandemic and whatnot. But before we do, just for the benefit of those who haven't encountered you before or heard the previous interview I had with you, or I know you've been on Tom Woods' show and others, can you explain, first of all, what is the Surgery Center of Oklahoma?
The Surgery Center of Oklahoma is an outpatient surgery center that was founded in 1997. Dr. Steve Lantier and I been in private practice for about 7 years and just decided we had to do something different. So we basically bought the operation of a failing surgery center on a hunting trip, actually, and started operating the business in May of 1997. It had become clear to us not long after we'd started our hospital practices that the hospitals were not really that dialed in to getting the surgeons what they needed, getting patients what they needed, and they also were preying on them financially. So,
and you mean prey with an E, not an A?
Right, exactly. Like as a predator,
right.
So we decided in order to really practice medicine and be involved in a mutually beneficial exchange, we had to control not just ourselves, but we had to control those elements outside of ourselves, which we had no control over, which meant the facility. So we started in 1997 and decided we'd never take a dime of money from the government, and we would quote patients what they owed us before they showed up. And even tell patients, a complete cash out the door price for various procedures. That made us the enemies, as you can imagine, of the local hospitals. Insurance companies hated us. We didn't really understand that until later. Mm-hmm. And so we started quoting prices over the phone, sustained multiple attacks from legislators, and even the health department was weaponized against us at one point.
Can I stop you at this point, Keith? Because I certainly people over 35 probably know exactly what you mean, but in case I have some young libertarian listeners who, haven't really directly, been to the hospital or anything, that might strike them as amazing. And that's the thing. My analogy is like, imagine if you had to go buy a car and after you bought the vehicle, the dealership told you how much it was. And can you imagine how screwed up the car market would be? And that's kind of like what healthcare is in the United States, where literally ahead of time you can't, or it's like pulling teeth to get them to tell you, and they'll even cover themselves too. Like if, my wife, when she was pregnant and, we were calling her and I was just calling around like, well, how much is this going to cost? And they didn't want to tell you. They really just didn't want to tell you. Or if they did, they would give all sorts of caveats like, well, assuming it's then this, but don't quote us on that. Like we reserve the right to charge you more. And it's, so can you speak a little bit to that? I mean, I know that's a huge question and, you have lots of things you've thought about over the years, but just to distill it down, how can that be? Like, why isn't it like a business?
Well, hospitals negotiate various contracts, and all the contracts are different. And so they follow one of the two models, economic models that's prevalent in the industry, where they attempt to maximize revenue. So in order for them to maximize the amount of money they can get for any service rendered, they really wait until all of the cards are in, and then they apply the charge master crazy retail rate after a procedure's over. And then there are various discounts that are weirdly applied. But the reason they won't tell someone up front is that they want to make sure they can get every single penny in case there's an extra Tylenol, that's given somewhere along the path. And we came to that realization really about 5 years ago. There really are two models in the industry. One is, how do I maximize revenue? And unfortunately, that's the prevailing model. The growing model, fortunately, is how do I maximize delivery of perceived value? Mm-hmm. And that's what markets do. And I think that's the model we follow.
So it's interesting. I mean, because a free market economist, if you grabbed us, before you guys did the Surgery Center of Oklahoma and said, why is healthcare screwed up like this? I'm sure we'd say, well, there must be some kind of government barriers, because otherwise, in other industries, like, why don't all the fast food restaurants just maximize revenue and tell people, no, go ahead and buy a Big Mac and then we'll tell you how much it is. And they couldn't get away with that, though, because if McDonald's did try that, then people would go to Burger King or whatever. And so it's interesting. You're showing actually it wasn't literally impossible to do, the consumer-friendly model. But is there some reason that it took you two guys in the late 90s to start this, when that seems like that should have happened long ago?
Well, it did happen in the plastic surgery world and in the LASIK world because those were basically cash businesses, and that was the nature of things prior to insurance going into this different kind of discount applying business. When insurance companies were really in the insurance business and they were following more of an indemnity sort of model, then prices were discoverable. So it wasn't that long ago, I'd say late 1950s, early 60s, even in the mid 60s, where you knew how much you were going to pay ahead of time. When the insurance companies, and a lot of this is downstream of effects that Medicare had when it was formed, and also the HMO Act, I think it was 1971, Nixon. That's when insurance companies got in this weird discounting business where it's basically prepayment of care for an unknown price. So I tell people the only thing worse than high-priced medical care are prices that are not discoverable because, high prices run people off and, force them to consider alternatives. But if the prices are unknown at all, then in the first place, the care is probably unavailable. So our our model is really just like, the plastic surgeons or the LASIK surgeons, people who pay cash. There's not an kind of distorting third-party intermediary that's attempting to skim off the transaction. And so we were the enemies of the insurance companies. They hated us, and the hospitals wanted the insurance companies to hate us.
Mm-hmm.
So as much as we wanted to be transparent with patients, the insurance companies actually made it easy for us because they wouldn't work with us.
Mm-hmm.
So we just got started on the right foot.
And can you, for the benefit of listeners who who haven't encountered this before, I don't know if you know any of these stats off the top of your head, but can you give an idea of just how much cheaper a standard procedure is going through you guys? Because I think a lot of people are like, oh, sure, Keith, for rich people, the Rush Limbaugh, if he needs to get his tonsils out, he can just write a check, but the rest of us need insurance. And so are you creating this niche product that only the wealthy can afford? And that's not really the case. Can you give I don't know, like I said, I don't mean to put you on the spot. I don't know if you have any examples, but it's astounding how much you were able to cut prices.
Yeah. As a general rule, our prices are 1/6 to 1/10 of what insurance companies pay hospitals for the identical procedure. And I say identical, I'll put that in quotes because I would argue the procedure is better done and the quality is actually higher. So 1/6 to 1/10 is what we've discovered. It's a dynamic number, though, and we're starting, particularly here in Oklahoma City, to see that fraction more favorable to patients because the hospitals really have had on this pricing move.
Okay, I'm just waiting for we had a little bit of a video lag there. I think we're back on track now. So,
okay.
That's really astonishing. So this isn't, they're adding 10 or 15% on top there in terms of waste or whatever. Like this is amazing. Like, so in other words, going the other way, whatever you charge for something, the hospital is getting paid by the insurance company possibly 10 times that.
That's right. 6 to 10 times. And it depends on where in the country you look. In areas of the country like Alaska and Wisconsin, where there is very little competition and one insurance company, completely dominates the market. Massachusetts, where you are, is another example where Blue Cross almost completely dominates the market. That's where you see the highest prices. And that's no surprise. There's no competition. It's very cartelized. And so patients travel to our center from those states where those prices are either outrageously high, maybe more than 10 times what we have listed online, in order to just be able to escape and buy the care. And keep in mind, too, a lot of the patients that we take care of are the very individuals who are run off by the hospitals because they cannot afford what the hospitals are going to charge them. We've had patients show up with the proceeds of a church bake sale, and the bake sale was successful because they knew that a tonsillectomy here was $3,000. And when we found out that's how they got here and that's where the money came from, we basically perform the procedure gratis. We do our part too. So it's just nice for physicians to have control of the institutional part of the charge, because if we can do anything and everything with that we would like.
So I'm curious, was it in the beginning you just didn't take government money, like meaning Medicare and Medicaid, but then you even didn't phased out regular insurance, or from the beginning was it just cash?
From the very beginning, we decided from the get-go we would never take government money, but we did take insurance money. We filed insurance claims as an out-of-network provider.
Right.
Patients would pay us whatever their portion was, but what we found was our entire fee was less than their deductible if they used their benefit at a hospital.
Mm-hmm.
And so that really formed the basis and was our formation. That helped us, though, sharpen our pencils because we knew what the cost of the procedures were. We knew how to quote bundled fees over the phone. And so we did take insurance money in the very beginning, but that didn't last very long. And when I posted the website, those days were over, and we don't have a single insurance contract now.
Mm-hmm. Can I ask? And this might be something that you can't answer, but I'm just curious in case you have any thoughts on it. When you hear statistics like that, like, oh, wow, these guys, the Surgery Center of Oklahoma, are doing procedures, and you guys are obviously making a living, and the typical hospital charges and the insurance reimburses them for 6 to 10 times as much. Is it that there's a group of people who are getting filthy rich from that, or is it instead that just spawns an entire army of people working for insurance companies and filing claims and handling paperwork that should be doing something else productive in society? You get what I'm saying? Is it so much that all that overpayment is going in the hands of a few rich people who are like, ha, 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 or is it just more, it's causing way too many people to go into healthcare broadly construed or health insurance?
Yeah, there are a lot of people making a lot of money in the healthcare business. Unfortunately, many times it's not the people who are doing the work.
Mm-hmm.
No one listens to any physicians who poor mouth because they somehow figure out how to make a living. But it's very distorting to the marketplace for fees, for instance, that Medicare sets to be below the market rate. So physicians increase their fees, in other areas and try to do things. If you look at a graph of physician reimbursement over the years, it's pretty flat. In some areas, it has declined, actual physician reimbursement. The hospitals are making a lot of money. Particularly not-for-profit hospitals have made a fortune. They complain that their emergency room is bankrupting them all the time, yet there's a crane out in front building on. They're constantly buying their competitors.
Mm-hmm.
They'll buy facilities like mine and close them. They run expensive advertising campaigns. You'll see healthcare ads on the Super Bowl.
Mm-hmm.
And so they buy physician practices. So hospitals have a lot of money that they use to expand their empire. And a place like mine, you look on the website and you see a price. That's what we think it costs for us to take care of patients. And there's no empire building fluff added on.
Mm-hmm. Okay. And so then what is the Free Market Medical Association?
Yeah. So when I posted the prices online, I was approached by Jay Kempton, who runs what's called a third-party administrator. That basically means that, a company that has, let's say, 50 or 100 employees, they decide they don't want to pay an insurance company, and have the insurance company take some risk or pay claims. Instead, that company, whether it's, a business like mine or, anybody else that's got 50 or 100 employees or more, typically, they actually pay for the healthcare. They pay the healthcare bills for their employees out of operating revenue.
Mm-hmm.
What they do, though, since they're no good at that, and that's not their business, is they hand their checkbook to a third-party administrator, somebody like Jay Kempton. So Jay Kempton, before he pays for someone's care, he makes sure, is this person actually an employee of this company?
Right.
And those kind of things. That way, the companies assume the risk and save a lot of money. Well, if you think through that, you realize those companies that are self-insured, that have a third-party administrator, they have the same sticker shock that an individual who does not have insurance.
Mm-hmm.
So when I posted the website, I was approached by these third-party administrators. Jay Kempton was the first, and they wanted to know, can I buy a knee replacement at Surgery Center of Oklahoma for $15,499 because I'm paying $125,000 for it across town. And of course, I said yes. And so we started doing business together, and there were local surgery centers and hospitals that began losing patients to me.
Mm-hmm.
And Jay Kempton had third-party administrators who were friends of his who were losing clients to him. And we decided, we were more missional than profit-driven. So we thought, and it was really Jay's idea. Jay said, why don't we form an association, and then we can make this a movement and teach everyone, how we do this. And so that's exactly what we did. That's how the Free Market Medical Association formed. And there's not a day that goes by that I don't talk to someone and talk them through some issue they're having trying to copy our model.
Mm-hmm.
And Jay would tell you the same thing. And it's grown. It's a large organization now. You've spoken there, and Jeff Deist, Ron Paul have spoken at the association meeting. So it's a nationwide organization and a growing movement.
So do you, that's the next question I was going to ask is, given what you're doing there in Oklahoma, so obviously some people can get on a plane and go fly and have you do the procedure, and they're still saving a boatload of money. But have there been analogs of what you guys have done there that have been popping up?
Yes, they're popping up all over the country. I would say Texas and Arizona and Florida right now are the three states where this has gained the most traction. Sometimes people say, well, why hasn't it grown any faster than it has? And I just shake my head and I say it's a miracle that it's grown at all, given the headwinds in the way the government and their cronies have worked so hard to keep this movement down. But it is growing. I think there are 37 state chapters of the Free Market Medical Association. One of the big components is a movement called direct primary care. These are primary care doctors that are paid $70 a month, and the patient has unlimited access to that physician. So that's one of the big parts of the association. And there are industry individuals that are involved, stop-loss carriers, a lot of third-party administrators. So it is growing, and it's popping up all over the country. There are hospitals that are increasingly becoming interested. I don't think Trump's executive order that will mandate hospitals to post prices will have much effect, except it changed the narrative.
Right.
It made those of us who do post prices not look like weirdos with a tinfoil hat. It seems like that ought to be the normal now. So there's not a week that goes by that I'm not having a conversation with a big hospital administrator that is interested in, how does this work and how can I be involved?
Okay, great. Can you give us an example when you say, there's headwinds that they go up against? I mean, is it just people bad-mouthing them, and so like regular employers are afraid to take the plunge because, oh no, what if we do this and then my employee gets in a bad car accident and then we wish we had insurance then? Is it that kind of thing, or is it like actual like regulatory attacks, or you know what I mean?
It's regulatory attacks. It's also collusion between the insurance companies and their henchmen that are boots on the ground, the brokers. There is fortunately a large and growing movement of brokers and consultants in the United States that is honest. But there's also a very large component of brokers that are reimbursed by and compensated by insurance companies in the most nefarious ways, where their interests are not only not aligned, but opposite of their supposed client. For instance, many brokers that represent employer health plans are paid a commission at the end of the year based on a percentage of claims made. So the broker absolutely wants nothing to do with Surgery Center of Oklahoma or a clone. They want the most expensive, god-awful, expensive experience that employer can possibly have. The other thing is, if the employer has a really bad year with their health plan, then their premiums go up the next year. And the brokers also, they get a commission based on how high the premium is. So there are all kinds of shenanigans, kickbacks on prescriptions from pharmacy benefit managers. And some of the big carriers actually own their own pharmacy benefit managers. So it's a very stacked deck. And I remind people, as much as the insurance companies and the hospitals and big pharma deserve all of the flogging they get, none of these scams are possible without Uncle Sam. Mm-hmm. All of these scams are downstream of regulations and laws that have been passed to enable this fleecing, really.
Right.
Dave Chase is a well-known speaker, and he's founded a thing called the Health Rosetta, and he calls PPOs the greatest American heist. And I don't think you can argue with that. It's just unconscionable.
Mm-hmm. Yeah, I'm glad you made that point, Keith, because it's I might not have thought to say it explicitly, just as taking it for granted. But yeah, obviously, the reason this stuff persists, it's not there's something intrinsically wrong with people who work in healthcare, or they're especially corrupt. It's just that there's just like if the government said every year there's only 100 people that are allowed to teach Rothbard, and you're going to pay us a fee. I'm sure after a while the people teaching Rothbard would not be my buddies. Like they wouldn't
be.
That's
right.
Okay.
Yeah, they've auctioned off all of these favors in Washington, and I tell people, just remember, when you've been fleeced by the healthcare industry, the medical industrial complex, just remember Uncle Sam's driving the getaway car.
Right.
So that it really is all downstream of favors that have been granted to these folks, and not just federal, but also at the state level.
Mm-hmm. And the tragedy, of course, is that the average person thrown in the web of this is going to just realize, when I go get my oil changed, it's nice and it's quick. And if they do a bad job, I take it somewhere else and I know how much it's going to be.
Right.
But healthcare is awful. And so when politicians come along and, healthcare is not working, that's why we need the government to take it over. And yeah, Bernie, go get them because these guys are mistreating me. Right. And ironically, that's just going to exacerbate the problem.
Yeah, everything that's wrong with healthcare that the American people hate is all a result of government intervention. So why in the world anyone would consider getting the government more involved? And the other thing to remember, the first patients to arrive in Oklahoma City when I posted prices were Canadians. And these people, they all have coverage, but they just don't have access to the care many of them require because there's no pricing system. There's no functioning market.
Yeah. So, I don't have any statistics. I know when I did the book that I co-authored with Doug McGuff on, the healthcare, economics of healthcare and so on, some of the statistics, like the wait times for a hip replacement or something in Canada were just outrageous. And that's why a lot of them, even though it was to them, free and guaranteed up there, and they had a great model, not like the Wild West of the U.S. crazy system, would come down and, get it from our allegedly inferior system because, I'd rather pay a certain price. And also, too, because they were willing just to go ahead and write a check, they could, if they searched, find someone to do it reasonably cheaply, as opposed to, the average American getting it, that same procedure.
Yeah, I've wondered if the United States ever goes down that sort of Medicare for all single payer path. I know that care that people require will become scarce, and I wonder if a free market movement will develop in Canada for Americans to access, so that they can leave the country and go get what they need.
Yeah, it'd be ironic. Can I ask you? So thank you for summarizing. What you guys have been doing. is there anything to add in terms of like the experience just from, 2020 and everything going on with the coronavirus scare? And, have you noticed a change in the type of clients you're getting or anything along those lines?
Sure. Oklahoma has a pretty good governor, and he made the mistake, like a lot of governors did, of taking the advice from the health department and shutting down elective surgeries. But he recognized his mistake shortly afterwards and rescinded that. So Oklahoma has remained, as a medical community, as a surgical provider, more open relatively than surrounding states or in most states in the country. As a result, during this COVID mess, we've seen the percentage of patients who travel to Oklahoma to have their surgery from outside of Oklahoma increase. So that there have been several days recently where there have been only one or two patients in my facility that are from Oklahoma, and everybody else is from a surrounding state. So it's pretty impressive. So these lockdowns, the banning of elective surgeries, and the more difficulty patients have with access, the more likely they've been to travel. So, but that's something that we've seen here in 2020.
Okay. I wanted to ask you too. So you, with the Mises Institute, I see you have an event that's on the calendar for June 17th in Windham, New Hampshire, called a Medical Freedom Summit, featuring you and Jeff Deist. Can you tell us a little bit about what that is?
Yeah, I'm really excited. I'm honored. It's the first time I've ever been asked to speak at a Mises event. I've been to many of them, so I'm very excited and honored to speak. You and Jeff have both become familiar with the Free Market Medical Association. It has a very, very property rights Austrian sort of approach, and so it seems natural that people would want to hear and be interested in sort of this Austrian flavored medical approach to medical delivery. So and I know Jeff is going to speak. He's talked, I know, to an actuary that's familiar with what we've done here, who may speak, and then I'll be talking, and I think what I'll talk about are all of the fallacies that the medical profession, physicians in particular, subscribe to, all of which are curable by just even a superficial knowledge of value and pricing and what those things mean and property rights and what that's meant to us here. So it'll be an exciting event in New Hampshire. I hope that people are able to gather in unlimited numbers, and I hope New Hampshire has a good governor, and they'll be open to a large crowd. And we're promoting that event on all of our social media, and I know Jeff Deist is too, with the Mises crowd.
And also, folks listening here, so if you go to bobmurphyshow.com/185, I'll have links and stuff too for those who want to see more details. So Keith, just the last thing I want to ask you about here is you just alluded to the fact that a lot of doctors espouse fallacies when it comes to this stuff. So I wanted to ask, does the average doctor, in your experience, do they buy into the idea that, oh yeah, healthcare is not something that should be treated like a commodity? It's not like TVs or whatever. That's why it needs to have its own set of rules, and you wouldn't want to treat it like a regular business. Like, is that pretty standard among doctors, or can they also see, yeah, this is crazy? And
yeah, I think most doctors don't get it. I think most doctors are believers in the idea that a free market does not apply to this industry. In their defense, they're all trained by people who are basically socialists. So it really takes an effort to break away and to think for yourself and realize that it basically is time and materials, and this can be priced And there are things that cannot be priced, but that's why insurance exists, to cover the uncertain elements. Unfortunately, insurance companies are not in that business. They're in some weird discounting business. But yeah, most doctors do not understand value. Most doctors think that, the harder I try, the more it's worth. They really struggle. I actually had a surgeon tell me that because I take longer to do this operation, I should be paid more. And they don't understand that, it's actually the efficient guy who takes less time who ought to be paid more. So a lot of physicians struggle with this, and I enjoy bringing them into the light sometimes when I have that opportunity. And I know Jeff Dice has used the phrase recently, post-persuasion America. I'm here to tell you most doctors are open to these ideas once they're exposed. There's some that are not, but most physicians know something is wrong.
Right.
It's a little bit of a leap for them to embrace, the idea that the market applies, but not that big of a leap.
Actually, last thing here, just because you mentioned it, I think I didn't ask you to clarify earlier. I'm sure many listeners know exactly what you mean, but for those who haven't been to getting a lot of procedures, when you say insurance, is supposed to be covering an uncertain but sort of known risk out, this thing costs something and you get it, like your house burns down, you have fire insurance. But the discount model you're referring to, you mean that when you get your bill from the hospital, it says, here was what we, the sticker price, discount because of Blue Cross covers such and such, and now patient's responsibility. So you're saying that weird thing, like, why is it that the insurance company talks down the price? Is that you're saying that that's something that in other markets, it's not like your insurance company talks down your mechanic as to how much the car bill is going to be?
Well, and the idea that they've talked the price down is actually a fiction. Right. Those prices are pre-negotiated. It's just the appearance of a discount. So, a hospital, I actually did a video on this called the $100 aspirin to explain it to people that, the hospital bills $100 for an aspirin and Blue Cross pays $20. And the hospital claims they lost $80 on that transaction. Never mind, they paid less than a penny for the aspirin. They'll claim they lost $80, and then they use that fictitious loss to maintain the actual fiction of their not-for-profit status. And they also get a kickback from the government, from the federal government, to the extent that they claim these losses. That's called uncompensated care. Then the insurance companies, applying this 80% discount, will ride in on their white horse to an employer and say, we saved you $80, and per the terms of our agreement, you owe us 30% of that savings. So there's this percentage of savings model that relies on an initial gigantic price. And, the hospitals and the insurance carriers are pals. All of this is pre-negotiated. So when it looks like a discount has been applied, that's all done ahead of time. There's no real service that's been provided. In fact, one hospital administrator told Jay Kempton he viewed PPOs as an ATM machine for his hospital. So, it's really a sick cartel. And it's been fairly disrupted by the number of people who have posted websites with prices, because that's the best way to uncover the scams.
Right. And then with that too, the other effect is the average person seeing that bill and seeing the aspirin originally was $100, and thank goodness, but it's a good thing I have insurance. What if I didn't have, I can't quit my job right now because I lose the insurance and I'm be paying $100 for an aspirin. This is crazy. So it reinforces the idea that you absolutely need health insurance to cover you, because otherwise you'd get blown away by these ludicrous prices.
Yeah, the fear, they rely on that fear to make sure that, everyone continues to shell out $1,200 or $1,500 a month for these ridiculous policies that really just give you an opportunity to meet your deductible.
Right.
Most of the procedures we have listed on our website are less than people's deductibles.
Okay, well, that's great stuff. Keith, I'll wrap this up. I know we hit the time I told you I'd have you for, and I appreciate your efforts so much. It's like, I speak at a lot of conferences and things, and usually it's like, oh, this is good stuff, and maybe somehow 30 years from now someone's going to take this. But when I spoke at your guys' event, like I really sensed, talking with the people there, this is actually helping people's lives immediately. This is good stuff. These people are really making a difference, to engage in a cliche there. So thanks for everything you're doing, Keith, and I hope you have more success in getting the word out.
Well, thanks, Bob. Thanks for having me.
Okay, take care.
You've just experienced another episode of The Bob Murphy Show, the podcast promoting free markets, free minds, and grateful souls. For more information and to subscribe to this podcast, visit bobmurphyshow.com.